So I'm Eric SCHNARR. I'm Systems Architect here at Accuray, and we're up in the development offices in Madison, here in the Madison campus. Almost 16 years. I was with the company from when we were only about 50 or so people. So as I said, I've worked with Accuray for a long time. A lot of that work has been in research, doing technology development and inventing new things. Most recently, I am the systems architect for Accuray, which means I'm looking at how the system is evolving, the technology is evolving, and how it all fits together for our various products, and making sure that it fits together and that we are able to execute on our roadmap as we go forward. I got a PhD in computer science because I love the technology. And Accuray, with the robotic radiotherapy and the tomotherapy machine, are both very high-tech devices, very interesting, lots of interesting technology. So from that point of view, it was interesting. It's a great additional benefit that doing this stuff I love is also helping people, really making a difference in the life of cancer patients and helping cure them. So at Accuray, through innovation in the field of radiotherapy, we are moving the field forward, actually making cancer treatment for patients through radiotherapy better, whether it's on our own devices or our competitors' devices. The innovations we've put in the field have forced the entire field to move forward, helping countless patients over the years. Currently, I'm working on the Synchrony feature, up-and-coming motion management capability for the tomotherapy platform to enable us to treat tumors that move inside the patient without needing to pause the treatment or delay it, and still be able to treat with precision. Okay. Sure. One of the most common types of motion that you would need to treat is treating tumors in the lung. Lung tumor is a very devastating, lung cancer, non-small cell lung cancer is a very devastating disease, and you need to deliver high doses to treat it. But the rest of the lung is very sensitive to radiation. So by being able to treat the tumor as it moves, we can treat just the tumor, miss most of the sensitive lung tissue, and deliver much higher doses without causing adverse side effects. And so having motion management able to handle lung tumors and similar types of tumors means that we can have a more curative effect, cure more patients with our machines. So Synchrony is very exciting. To implement Synchrony, we're putting additional imaging capabilities on the system, so look for additional imaging capabilities coming as well to follow after Synchrony at some point. It's all going to be very, very exciting. So Synchrony on tomotherapy shares a lot in common with Synchrony on CyberKnife. We're taking KV snapshot images to see inside the patient and see what the tumor's doing. And we have a camera system outside the patient that can monitor their breathing the whole time. And we build a model between the two, just like CyberKnife does. What's different is that on tomotherapy, we correct for that motion with the JAWS and the MLC, using them to repoint the beam in real time rather than by actually moving a robot like CyberKnife does. It's a very similar approach in general, but to make it all work on tomotherapy was a whole bunch of new technology. So we've been seeing a lot of machines, including tomotherapy and CyberKnife, as well as others out there, adding more and more advanced imaging onto the systems. So that will definitely be a part of it. But the other part is what you do with that imaging. And so one thing that I know Accuray has been involved in for both tomotherapy and CyberKnife is adaptive therapy, using the imaging to better understand what has been happening during the course of treatment, and then adapting to that treatment, either by replanning offline partway through the treatment, or beginning to look at what could you actually do at the time of treatment to improve based on the images you're seeing. There's a trend in radiotherapy towards hypofractionation. Larger fractions, fewer of them, means you don't have to bring the patient in as often, and often for the same curative effect. But in order to deliver larger fractions, you need to be more precise. If the tumor moves, you don't want to miss it because there's fewer opportunities to hit it. So motion management is essential for doing this stereotactic body radiotherapy, where you're delivering large dose in just a few fractions. Motion management makes that possible for sites like prostate or other sites in the abdomen, or for lung tumors where really high doses are needed to cure non-small cell lung cancer. And the precision that motion allows you to give very high doses to tumors like that. Okay. There are actually many. I'm always proud when I'm involved in a new technology or new feature that Accuray invents and seeing it get out to the field. From TomoDirect that enabled tomotherapy a better machine for treating breast cases, or adaptive therapy, which allows the physician and the clinic to monitor what doses have been being delivered to the patient and adapt to this new synchrony capabilities that are coming along now. Yeah, a common thing that we do is we have a clinical advisory board, often for each project we work on. There is a clinical advisory board for synchrony, and there are other clinical advisory boards for other projects where we have experts in the field, come in, we talk with them, we go to their site and talk with them and get their feedback on what they want most out of the new features we're developing. Okay. We show them demos when we have something basically functional, and we show them as it becomes more and more flushed out. We show them what it looks like and get their feedback at all stages. So from very early, before there's anything, to as it really starts to come together.